Hi everyone, I will give this live here a moment to get started. My name is Mari Cockrell. I'm Communications Director for the City of Abilene. And we wanted to come online and go live just to add a little more clarity to the change in our COVID testing numbers that you're seeing today. Understandably, the number is confusing as it's posting here for today. It's 206 is our number of positive cases for Taylor County. And so I wanted to explain what has happened. Basically, the state, the Texas Department of State Health Services, notified the health district today of two changes that needed to happen in our reporting. One change was the elimination of what is a serology, or better known as the antibody test. So basically, what has been happening is that, you guys are getting lots of white noise, I'm sorry, not getting any better for you, but basically what is happening is two tests out there that you might be familiar with. There's the PCR test, which is the nasal swab, and there's also a serology test. It's basically just testing for antibodies. So the PCR test is what we'll say, for tried and true test, and the serology test that tests for antibodies is also a good tool to use, but the state has notified the health district that we should not be counting that serology antibody test in our total testing numbers, and we had been doing that as the district has been reporting those numbers in with the PCR test. So as of today, moving forward, we need to only be reporting the PCR testing. So that eliminated for us what was 82 tests for the city. And so that was one thing, bringing your numbers down. The other thing was a clarification in that we had been reporting the positive cases out of the Middleton and Robertson prison units as being part of Taylor County. Well, as some folks may be familiar, the address for those units is Abilene, but they are indeed in Jones County. And so with that, those cases now need to be moved over and reported as part of Jones County. So that accounted for 94 of the positives that we had accounted for in the Taylor County test. So when you take out the 94 of the prisoners and you take out the 82 of the antibody tests, then we get to the 206 that you saw for today. So moving forward, we will have the building off of that 206 number, and this does provide some clarity in seeing that the reason that the state was telling us to do this is that other cities across the state have not been using the serology test, and so it gives us a little bit more comparing apples to other cities, and so that's the reason there is that. So we also want to let folks know that moving forward here, we are just going to see the sort of simplified graphic that you saw today, just because all of our demographic information, our staff at the health district is going to have to maybe go through and pull out what had been inmates from the units and also antibody tests. And so once that comes out, then we'll come back and bring back demographic information for you as well. So definitely want to return to that, but until we get that all cleared up and spreadsheets cleared up, we're going to keep with the more simplified graphic that you'll see there. Otherwise, I just wanted to provide a little bit more there. I know the health district also really wants to stress to people that while the numbers are looking lower, still please continue with social distancing, sanitization, all those things that we've been talking about, and wearing masks in public, as it does help reduce the spread of COVID-19. And so just a little bit more information there. If you have questions, please do post here in the video. I understand it may have been the audio may be a little hard, but unfortunately, I'm not really sure why that might be the case, but if you do have questions, please do share, and we'll keep you up to date with what we get moving forward. Thanks so much.